The topic for the presentation will be a customized controlled suprachoroidal space injection. So the concept of suprachoroidal injection is basically to deposit the drug in a suprachoroidal space, which is a redundant space, not a free available space like a vitreous cavity where we can inject. So we need a needle or an instrument which can safely deposit the drug in the suprachoroidal space, for which I have designed. This is a self-made needle which I have designed by myself. It has got just 100 microns of exposure superficially, and it's got a metallic sleeve, and the idea is to deposit 0.1 ml of triamcinolone in the suprachoroidal space. These were the previous ones which were available, which were done previously. This is quite invasive. This is done by a clear side, but that has been patented by them. So these were the different needles which were tried with no success. So basically these are the tools that were used to make the needle, and this is a final needle that what I got, both 26 and 30 gauge. So this is a metallic sleeve with just an exposure of 1000 microns of the hub of the needle, which can go into the suprachoroidal space, inject the drug, and come out safely. So there are different sleeves. The length of the sleeves are made in a different lengths because the size or the length of the needle also varies. So the sleeves which can give an exposure of 1000 microns are the one which are selected. They are autoclaved. They are used. Basically, the mode of injection is under topical anesthesia, and you go into the temporal quadrant facing the hub of the needle facing away from the limbus, inject and come out. So none of the cases required AC paracentesis. There were no IOP rise on the table. I am not able to show the video because of the time constraint. These are the cases that we included and excluded initially. Basically, the cases which had a suprachoroidal space thickness less than 1000 microns, the glaucoma suspect patients there. So those are the ones which we excluded. These are the different patients I have done. Because of time constraint, I will not be able to show the videos. And this is an anterior segment OCT demonstrating the suprachoroidal space triamcinolone which is there in the suprachoroidal space. So these are the cases which were done by me. So most of the cases now they have completed more than 6 months of follow-up, and the cases varied from CNVM to serpiginous choroiditis to CMEs and VKH. And these are the cases which I have done, and none of the cases I had any terms of complications in terms of bleeding or glaucoma or IOP rises. So this is a prototype case which was done in the initial time. This patient was on multiple medications, on immunosuppressants also, with lot of recurrences of these choroidal nodules which kept on coming. So this is a pre-op. This is just 3 days post-injection, and this is on the 7th day where the choroidal nodules have totally disappeared. And this is also the same patient wherein this is at the first week the patient had CME because the lesions were quite close to the macula, and this is totally resolved on injection. And this is on the 2 months of follow-up where the FFA is showing the scarring pattern, basically indicating the lesions are fully healed. The case of VKH.
You finish, your time is up.
So these are some of the cases which were done. And this is also a case of CNVM which we have injected. This is a case of CNVM which kept on recurring, and it disappeared totally on suprachoroidal injection. So in conclusion, it requires a specialized needle which requires drug to be deposited in the suprachoroidal space. There are some of the cases which were not responding to the regular treatment, which responded quite well, and there was no subsequent recurrences also. In terms of complications, there were no anterior segment complications either in cataract or glaucoma. And none of the cases have a risk of endophthalmitis because the courts of the eye is not breached. Thank you.
So I have questions for you. You said that you inject 0.1 ml of 0.1 cc of suprachoroidal injection. So what advantage do you get by injecting just 0.1 cc there?
So initial when we started this, because it was not there done by anybody, only the company which were doing.
Did you look for the? Did you do Google for this that nobody else was doing? When did you start this?
This was started in 2018, end of it. So that time Clearside was doing it. They were also doing it in 0.1 ml. So which they didn't find any, and the total volume of the suprachoroidal space as such is 1 ml. It's a redundant space. So we decided 1/10 of the volume, which doesn't give much of expansion and doesn't vary the volumes of the eye inside also. IOP was also the main concern.
Okay, the second question is, how do you assess every patient for the thickness of choroid?
Yes, sir.
How
Before we take up the patient, the anterior segment OCT is done in the temporal quadrant, and the patients wherein the choroidal thickness and the whole of the thickness is less than 1000 microns, we have excluded them. I have not given option for those patients.